Hi, I'm Will, reporting for the Mental Health. You're joining us live at the end of the first day of the Quality Improvement Forum. I'm here with four of the science leads who are going to tell us a little bit about who they are and what the work they do and the day they've had today. So over to you.
Hi, I'm Pierre Barker. I'm IHI's Chief Scientific Officer, and we've had a fantastic first day of science at the forum, and that's what we're about. What Amar and I, as co-chairs of the science track, are trying to do is really up our game in science at the forum. And the reason for that is because the science of improvement is the essence of what makes quality and safety successful. It's our ability to really have an impact by improving the designs that we use, improving the evaluation of our work. And what we're trying to show is that all of that methodology is accessible, simplify it, make it available to the people. And that's what we've been doing through our sessions today. We've had really great crowds come to see us and have really participated in the work. And so couldn't be more happy and looking forward to the next 2 days.
Hi, I'm Sarah O'Brien. I'm part of the Lived Experience and Communities panel and one of the co-chairs for the science stream. For me, it's been a really kind of eye-opening day. I've had things talking about improvement in the morning and talking about involvement in the afternoon, and how that's really important to kind of bringing in to how we look at health and safety in healthcare. For the science stream, I think it's really important to think about making things as accessible and inclusive as possible for the public, so that it's not something that's off in the distance kind of with jargon and really kind of hard to reach, but rather it's explained, as Pierre said, in much simpler terms, so that people can engage with things and can challenge when healthcare is going wrong and can push for improvement into their healthcare.
Thanks so much. My name is Jonathan. I'm Director of Improvement Science at St. Jude Children's Research Hospital in Memphis, Tennessee, and some of us just had a 3-hour session trying to accomplish exactly what Sarah just described. So how do we take this sort of abstract topic of rigor and really make it accessible and relatable and something that anyone can apply, whether they're experienced improvement practitioners, so they can apply the work with rigor, or if they're the really busy clinician who doesn't have the time and the energy and the knowledge to learn all the jargon and et cetera, but still be involved in these sort of activities at a rigorous level, those that know they're making a meaningful impact. And so it was a good experience, and we'll see what the feedback looks like, but I think we got there in some aspects.
And I'm Amar. I'm a physician and Chief Quality Officer at the health system here in East London, and with Pierre as the lead for this stream. I think we've had two main objectives. One is to raise the standard of the science, to demonstrate how really rigorous, well done improvement work can deliver better results for the people we serve. And the second objective for us has been just to make the science seem sexy, to get people interested and excited in the science. And I'm really thrilled that of the top 10 most popular sessions this year, 2 of them are from the science stream. We've got a fantastic lineup this week, looking at artificial intelligence and improvement science, looking at how to best design and evaluate quality improvement work, looking at some of the newest, highest impact publications in the field. Really looking forward to the forum this week.
Just so I can understand properly and so people watching understand, you essentially using the themes from science and the scientific method and applying those to the world of quality improvement. Is that not something that we would normally do in practice anyway, or are they quite different in reality?
Yeah, I think you raise a very good point. Improvement science is how this all started, just to try to make the implementation of the evidence, what we should be doing, happen better. And so that's not what always happens. And even in our own quality improvement community, we often practice improvement science, but we don't always do it very well. And what we're trying to do is give people the tools to make it easy to do, and to know whether they are being successful. So we're spending quite a lot of time and effort on looking at ways of learning, ways of looking at the data, evaluating how well we're doing. And those are tools that have been missing or not so visible to the people who are trying to do this. And we're trying to make them more visible and easier to use.
I think something that's really stood out for me is bringing that kind of human element in, so making sure that improvement and science, don't forget that there is a human at either side of this, whether that be a researcher, a clinician, or a patient or public or carer. And that's something that's really brought itself through in the streams, where it's focusing on kind of demystifying that and making it, as Amar said, as sexy, as clear, as kind of approachable as possible.
Thank you very much for joining us, and thanks for taking the time to speak to us and to people who are watching at home. It's been nice to meet you all, and I hope you enjoy the rest of the conference. Thank you very much.